Hi there. So now we're going to talk about oral hygiene instruction. So besides coming and attending to the dental practice for the advice and treatment, the most important aspect of treatment is self-care and your efforts at home, because without that there is no point in having any treatment, because the bacteria will build up on a daily basis and still continue to cause damage. Now, what I explain to patients is the three fundamentals. On that, we can build and develop the habits at home. But what I start with is incidental cleaning first. So on the market, there are a variety of tools and techniques to use. Some which I have here. You have these little rubber flexible devices, or you have the bottle brushes and other brands available, which are a little wire with filaments around them. Okay, now this is to be done every night before brushing if possible. The idea being that you've had food, drinks all day. You don't want to go to bed with the food stuck between your teeth. And the reason we do it before brushing rather than after brushing is that it pushes all the bacteria out of the interdental space, or the gap between the teeth, so that when you do brush your teeth, it allows the toothpaste to then circulate through the gaps and keep them areas nice and healthy. So again, a reason for attending the practice is that I can size you up, because there are a variety of sizes, as you can see here. It goes from a large grey right down to a pink one in various brands. Now, what I tend to ask patients to do is not go for the flexi ones, because there's not many filaments on these, and to go for the ones with the brush instead. So brush here, and you simply pop in between the teeth and gently compress and massage one side and down the other side, then take it out, in one side, outside, and so on. Okay, but you have to ensure you have the right size that fits the gap, because if it's too loose, it's not touching the sides. If it's too tight, you could cause damage, which is why we as professionals come into that to size you appropriately. So following on from that, we then go on to toothbrushing. Now, the toothbrushing I recommend is an electric toothbrush. So the Oral-B ones are fantastic. They are evidence-based because they oscillate and rotate to remove the bacteria, compared to a manual toothbrush, which you have to scrub side to side and circular motion to try and remove the bacteria. Is quite challenging, especially if you have dexterity problems. Now, the simple technique with the electric toothbrush is not have it flat on the teeth. You want about a 45-degree angle into the gum. So into the gum, and you gently move it around. We don't brush backwards and forwards, because you can't put too much pressure and cause the gum to become traumatized. However, these have inbuilt pressure sensors, so if you press too hard, a red light comes on to warn you that you're pressing too hard and to ease off the pressure. Lastly, what I would advise is, once you finish brushing, is to spit out, but do not rinse your mouth. So keep the toothpaste in there as much as you can, and that is where your fluoride protection comes in. Now, as part of your dental care plan, you may be prescribed or advised a mouthwash, but I would only do this if you have been told to do so. Okay,